Okay, so before we start, I just kind of want to make a couple of statements. I just saw a newscaster who described our world as like living in a tinderbox. All the time. It just feels like everybody's on edge all the time, and we keep saying this is unprecedented. This is unprecedented, and that's because it's true. I don't think any of us have felt this way in our lifetime, where we feel like everything we've counted on is just constantly being turned upside down. And it seems like everybody's on edge and just angry all the time. And we argue about what's fact and fiction and what's gut feeling versus objective truth, And I think we can all agree, we're tired of living like that. We're living in a world where everybody just feels like it's just tense and tight all the time. And I think we all wish we could get past that. And I believe at some point we will, I hope. I definitely feel like that when we're talking about schools, being on edge and being, upset about it. It makes sense. When you talk about changing anything with schools, even like little tiny things, it evokes a very emotional reaction from folks. But these are not little tiny things. These are big things, obviously. And, there are no perfect solutions to this situation. So tonight, all I can do is be as honest as I can. And we're going to present what we think is the most appropriate model, trying to balance safety with a plan for moving students and staff ultimately back together into buildings. And so I just ask that people give it a listen. I welcome everybody who's here. Absolutely happy to have constructive criticism, happy to have feedback. We fully expect not everybody is going to agree with our decision, and that's okay. This is an impossible situation for schools. We've been given very few resources, very little guidance, and you're going to hear me say this again and again. The attitude has been, as long as you've got masks and social distancing, give it a shot. If you feel safe, go for it. And in my mind, for what it's worth, that's not good enough. It just isn't. But here we are, and we're going to absolutely do our best. So that is something I can give. So moving on. I'm going to spend some time tonight talking about where we've been, some of the conversations we've had, some of the data we're using, how we've obtained it, and our decision-making process. We're going to talk about some of the things that we've had to deal with, sometimes successfully, sometimes not so much. I'm going to spend some time talking about metrics and what are some of the metrics that we'll be looking at as we decide to go from remote to hybrid and hopefully, ultimately, in person, fully in person at some point. Excuse me. I'm going to go into some length about some of the frustrations that we've had with trying to come to a reasonable decision about all of this. Lots of unknowns here. There are multiple governmental agencies and multiple voices, and sadly, nobody seems to be on the same sheet of music. So that's something we're trying to overcome. But I really want to talk about our plan for moving from full remote to bring students back to the building. The first step would be hybrid when we do that. I don't think anybody disagrees that the best place for our students is with our trusted caring adults in our buildings. The question is how fast can we do it, and how can we do it with a reasonable amount of safety. At the last board meeting, I talked a little bit about what we weren't going to do, right? We weren't going to implement our hybrid model right away. I didn't tell you what we are going to do, and that is remote learning. It's going to be very, very different than last spring, so I want to talk about how different it's going to be. And then finally, I'd like to talk about some of the next steps and the resources our teachers are putting together for our students and their families. Okay, so we're going to start with a little bit of background. Excuse me. This is a slide that I'd used on another presentation for the board. I just want to remind everybody kind of what our process has been. For our task force, we kind of divided up this work into a number of subcommittees, so academics, communication, operations, student supports, staff supports, technology. Our initial stakeholder participation, we had a parent survey kind of early in the process, 135 parents. We had focus groups, really valuable conversation with parents, and there were 39 parents that were involved with that. We had staff surveys, staff focus groups, and a student survey with over 1,100 participants. I do want to give a shout out to, we have subcommittees within our subcommittees, and so the academic team, a lot of Grays Lake staff and administrators worked on that. I want to give a shout out to all of those teachers, administrators, staff members there. Operations, it was our team along with our partners like Aramark, Durham, WFF, and Permar, and then staff support, looking at our staff needs. And again, I want to thank very much our teachers, our staff, our counselors, everybody who's involved with that. So I wanted to give them a shout out real quick. A lot of work went into this. into the hybrid model and into the remote model, and they deserve a lot of credit for it. So this is another slide that I'm reusing. These are some of the highlights, I guess, some of the main themes that we pulled out from our focus group of parents. And again, we had 21 Central parents and 18 North parents who participated in a number of different sessions that we had a conversation with. So parents remarked that they appreciated the number of times some staff reached out to their students. There was a desire for more teachers and counselors to make personal contact more regularly if we're learning remotely again. And once we get to the remote learning 2.0, you're going to see much, much more of that. Participants widely shared appreciation for the consistent communication from the district and the buildings throughout the process. We definitely want to continue that. Parents indicated a desire for more scheduled Zoom meetings and structured instruction. You will definitely see that in our plan. Most parents who remarked on the Bell schedule appreciated the shift to the block schedule during remote learning, and we are going to continue that because we felt it worked well for our students and our staff as well, the block schedule. Parents asked about how students in hands-on classes like career tech education would engage in the fall if we're learning remotely, and that's something we're still working on. We have some ideas with that, but between that and also the tech campus, we'll talk about that. And parents widely agreed that the no new grades or the do no harm mandate impacted their students' engagement. And we agree, and you're going to hear me say about 800 times, grades count. Okay? We think that is hopefully will help some engagement, but grades are going to count this time. The do no harm policy, while we think it was a good idea for that emergency situation, we'll be able to get back to what would be a more normal school experience. Okay, so this is a survey we sent out on January 2nd. So it's a community survey in which we asked the community's feelings about sending students back to school. And it's about 936. It was a little over a third of all of our families. And again, as I say, it was sent on July 2nd, which in COVID planning time feels like about a year ago. We consider this, I just want to explain, we consider this mainly a temperature check. And what I mean by that is without providing many details. I think I said we're thinking about a hybrid program, 33% of the students in the building at any one time. I don't think I added any more details on that because we were still working on it. So without having full knowledge of the guidance and the regulations and the requirements that are going to have to be in place to send students back to school, we just wanted to know, where's our community at with all this? You know, is there panic about sending students back to schools? Well, clearly there is not. 83% of these respondents, I think at the last meeting I said 85, I apologize for that, it was 83. 83% of these respondents indicated they would either lean towards sending their students back or they are definitely ready to send their students back. 17% leaned no or responded with a definite no. So this data is instructive. It gives us a sense where the community is at in general, but it's not the end of our decision-making process. It was not intended to be an up or down vote on a plan. We were still working on the plan. If the data had gone the other way, however, and our community was less willing to send students back, that's a different conversation, that's a different discussion. We would have worked on a very different plan. What it tells us is that we should have proceeded, and we did, with investigating a plan of bringing back students in a hybrid way. And again, we did, and we have it for use when we believe it's appropriate. I'll talk more about that in a minute. But there are other factors we have to consider in bringing students back. Again, the question is really not, do we want students in the buildings? Absolutely we do. It's how we do it and at what pace. Okay, so this is another reused slide. I just want to review some of our survey results from our students. These are some of the themes that popped up. One of our questions that I think was probably the most informative was, one thing I'd like teachers to continue was, and this comes from students, so we just copied and pasted it right from their responses. So giving out assignments that are due in a couple of days. Making assignments due daily really puts kids who might have a job at night one day but are completely free the next, that might make students stressed. You're going to see that in our plan. Again, the block scheduling helps with that, but we want to make sure students are able to plan, those students that need that extra time to plan and look ahead and can look ahead and work ahead, they're able to do that. I really like when teachers have things posted the weekend before, a little in advance, as I mentioned, because I really like to plan out my week so I have a good idea of my time management. The hyperdoc with links and the step-by-step dates was okay, and this is kind of getting to the same thing. Students really liked in this remote environment having the information set out ahead of time so they can, again, plan or work ahead or do what they need to do and use their time more like adults do, frankly, and plan it out. They've helped to bring structure to our time schedules, which has helped me to get my work done in a timely manner. Okay, so again, we'll talk about structure. I would like teachers to set up a Zoom at least once a week to check on students to see how they're doing. Most of my teachers have been doing it whenever. So again, you're going to see much more synchronous, real-time learning and check-ins with students. That's a big part of our plan. I'd like them to continue to tell us that they are here for us. I would like that too, and I think that will continue. So I want to take a moment to talk about our staff. And of course, our first priority is to our students. We have more than students in our school community, right? And when we're talking about reopening, we have a charge to protect everyone. So we've got, of course, students, teachers, support staff, counselors, social workers, librarians, school psychologists, speech pathologists, deans, paraprofessionals, one-on-one aides, substitute teachers, coaches, food service, transportation, security, maintenance, and administrators. And I probably missed somebody, and I apologize if I did. Like I say, we have a charge to protect everyone, and these folks are a part of our school community also. We have had weekly listening sessions with our staff, which have been well attended. We've discussed all aspects of the hybrid plan and then the remote plan. I think we've gone into pretty great detail with them, and we've tried to address their concerns. They also provided great ideas and some really great positive energy into all of this. So whatever your belief about student susceptibility to this virus, clearly adults contract it and spread it. Teenagers contract it and spread it too. And there's data to believe they spread it as much as adults. I get concerned when I hear the discussion, like particularly nationally, when I hear the discussion of reopening schools and I don't hear any mention of the risks put to adults. In our district, we've got about approximately 500-ish adult employees for 2,800 students. We've got staff members who are worried about their health and the health of their loved ones. So, and again, nationally, there are stories of teachers and staff considering taking leaves and leaving the profession, and that's sad. As an educator, I think everybody should be an educator or a teacher or work in schools. That's just me. So we definitely want to avoid that in our district. We want to hang on to our quality staff. So again, these are the ones who have to implement whatever model we decide on. They're the ones in the room, so to speak. These are the adults who would run through a wall for our kids and who would risk their own safety for our kids. And they'd probably do it without saying a word, because that's who they are. I see it as my job to say that word on their behalf. I just need to note, again, that their ideas, their considerations, and concerns are part of this equation too. Okay, so let's talk about remote versus hybrid. And some of the things that we have considered, debating whether it should be a remote or a hybrid model to start the year. I want to talk about this a little bit. What does the American Academy of Pediatrics say? Quite a bit has been made of the AAP, their position about sending students back to school. They came out advocating a position that the goal should be all students should go back to school, and we agree with that. That is absolutely the goal. However, what doesn't get reported as much is the fact that that recommendation was not unconditional. That recommendation was based on being able to do it safely, being able to do it based on guidance and the knowledge and the recommendation of local health experts and the expertise of educators. Following their initial guidance, which got quite a bit of publicity, they later released a joint statement with the American Federation of Teachers, the National Education Association, which are the major national teachers unions across the country, and the American Association of School Administrators, which is the School Superintendents Association. I'm going to put up a few points from their statement. This is not the complete statement. This presentation will be shared, and there's a link there to the full statement. But here's some of the highlights. The header on their statement read this way: science and community circumstances must guide decision-making. Funding is critical. That's another issue. So the AAP, the AFT, the NEA, and the AASA joined together today in the following statement on the safe return of students, teachers, and staff to schools. They went on to say, educators and pediatricians share the goal of children returning safely to school this fall. Our organizations are committed to doing everything we can so that all students have the opportunity to safely resume in-person learning. Returning to school is important for the healthy development and well-being of children, but we must pursue reopening in a way that is safe for all students, teachers, and staff. Science should drive decision-making on safely reopening schools. Public health agencies must make recommendations based on evidence, not politics. We should leave it to health experts to tell us when the time is best to open up school buildings and listen to educators and administrators to shape how we do it. So I just wanted to throw that out there. You know, I think we all have the same goal of getting kids back. It's just, again, how do we do it safely? How do we figure out the best way to do this? We are moving in the wrong direction. And that rather jarring quote comes from Mark Pfister, who's the director of the Lake County Department of Health, who has been on calls with the Lake County superintendents last week and then again this week. He's helped us understand some of the guidance and some of the indicators we should be looking at as we make these decisions. And I've got a few quotes of his. Hopefully I will characterize his thoughts accurately. So he basically started off by saying, so for you superintendents, I don't have good news for you today. We're moving in the wrong direction. We're seeing more cases, which is what's happening nationally. He went on to say, we're concerned about what will happen this fall. Students coming to school after being in gatherings that are very large, and they're going to be bringing COVID-19 to your facilities. We knew that. So that being said, our expectation, you will be working with us, the health department, for sure. If you're open because you will have COVID-19 cases, that's a given. And again, we understand that. Now, what I have to say about the health department is they are not going to make a blanket recommendation, I don't believe, about opening or closing schools, right? They're not going to say Lake County schools got to close, anything like that. They did work with Lake Zurich with their outbreak and made that recommendation to shut down those sports camps, but that was like a really specific situation. Regardless, we put him on the spot and asked him, Mark, how comfortable are you with us opening up schools? And he answered, so my answer is, if I was in your shoes, I'd be preparing for a hybrid model and expecting you may have to go remote learning regardless. We're not even out of the first wave yet, and I'm very concerned about the second wave happening this fall. When you bring back all of these students in the fall, we already know what happens with other respiratory illnesses, so we definitely expect issues to arise. I'd be looking at a hybrid model, but remote learning if possible. Okay. So I'll kind of refer to some of Mark's advice as we go, but I wanted to let that out there and give people a sense of where our health department is leaning. When we talk about research regarding spread, you know, this study has been discussed quite a bit. I'm not going to go through all of these bullets. I'll try to just describe what it means. But this language, including that highlight, was actually sent to us specifically by the health department. They wanted us to take note of this study. What it states is that older students do spread the virus. And what seems to come out of that is that older students actually spread the virus as well as adults. And again, it is one study, but it's one of the few we specifically have about high school age students. Research is not settled because it can't be. It's too new. We don't even really know about the effects of the virus are on kids. It's more than the cold or the flu. It would be great if some governmental agency could take all of this information on schools from all over the world and summarize it. What happened in Finland, in Denmark, and South Korea? What's going on in Israel, China, Germany? Some countries have been successful in bringing students back to schools and some haven't. Are we comparing apples to apples? Is it the same age children? Okay, so a study that talks about kids under 10 is not as useful to me in a high school setting than a study on teenagers. Do we have similar conditions? Are there societal differences? Are there differences in attitude toward masking and testing? Are those different? Do these other countries have a better handle on the virus and more effective response measures like testing and tracing? Does any of that impact the conclusions we can come to as far as reopening schools in this country, in Lake County, in Grays Lake? Unfortunately, that would be nice if we had that kind of like a meta-analysis, but we don't have it because, again, we're on our own. Okay, so I have been asked by members of the community, I think absolutely rightfully so, what metrics are we going to be using? You know, how are we going to make these decisions? And I'd like to talk about two quantitative numerical measures that we're going to be looking at after the conversations that we've had with the health department. One metric is the new daily cases, okay, and that is the number of new cases per 100,000 residents, right? So that per 100,000 residents, so we can compare Lake County, Illinois to LA County in California, obviously much bigger, but so we can kind of compare similar rates. In Lake County right now, that number is 63 per 100,000. That's a weekly number, but unfortunately the target is less than 50, and it's not going in the right direction. We've heard that the health department, the health department will list a number of states that if you visit them, you should self-isolate for 14 days. And you can probably imagine what states some of those might be: Texas, California, Florida, and a number of the other southern and western states that are having some pretty bad outbreaks right now. States are going on the no travel list if they get a daily incidence rate. Okay, so the 63 is a weekly incidence rate, the daily incidence rate. They would go on that list if they get it over 15 per 100,000. And on one day last week, we had 93 new cases in Lake County. So we are at a daily rate right now, you mentioned, of 13.2 per 100,000, right? So if Lake County were a state, we're getting close to the number where we would advise people they have to quarantine coming into Lake County. One other interesting note, Wisconsin is getting close to that rate as well. And I'm going to be honest, we don't know exactly what will happen if Wisconsin is put on such a list. I know the city of Chicago just put Wisconsin on that list. But we have a number of staff members who live in Wisconsin. What does that mean? Are there exemptions for employees? We don't really know. It would be a big problem because we have a number of employees, as I say, living in Wisconsin. And if we're limiting the travel, like certainly that would impact our ability to teach in person. Okay, there's a lot there. So here's the second number we're going to be looking at. The positive test rate, which is just the percent of positive tests daily, right? Lake County uses 8% kind of as a target value. Incidentally, the World Health Organization uses 5%, whatever. But I believe the CDC once used 5% as a number, but I can't find that stated anywhere anymore. But what I mean by that, if we start to see a daily positive test rate, so that's the number of positive tests divided by the total tests, if we start to see a daily positive test rate of 8% over a sustained period, we might see mitigation measures come into play. On the bottom left there, and you're not meant to read that, but that's a copy of an email sent by the health department warning of this. It states that any region that sustains an 8% positivity rate for 3 consecutive days or sees an increase in positive rates, plus a corresponding decrease in hospital capacity, will need to implement additional community mitigation measures. So does that mean going back to phase 3? Or are there other, it seems like there's a menu of options that we could do, but once that gets triggered, that means something is not right, and we need to back up a little bit and get better control of the virus. Yeah, regardless, they take that 8% as a line we don't want to cross. You can also see the chart that I copied on the bottom right there, copied from the Illinois Department of Public Health at our region, and our region right now is Lake and McHenry counties. We've seen 9 days of positive increases, and we are well over the 5% mark. So it's 5.3% today. This is the latest data. I pulled that right before we walked in here. Okay, so I want to talk a little bit more about the positive test rate and some of the metrics we'll be using here. I've been trying to pull the current positive test rate. So for example, for the state right now is 3.8%. And remember that 8% line, 5% or 8%, but for Lake County it's 8%. This number was reported by Governor Pritzker, and that is a weekly number, as I understand it, as it was reported, and that's the week 7/21 through 7/27. Okay. Lake County went on the Illinois Department of Public Health to pull the Lake County number. It's currently 3.4%. Problem with that is what's reported right now is July 12th through July 18th. So we're not really comparing the same time. It may have increased in that time. We'll take a look at the region, and again, that's Lake and McHenry counties, so they give data for that. It's currently 5.3% from the graph previously. That's a 7-day average, I believe. Sorry, 7:30, I believe it was from 7/27. I just pulled it today, 7:30. But noting that we have 9 days of positivity increases. Okay? So that's great. The state is what it is. The county is what it is. The region, it's Lake and McHenry counties. What I want to do is actually develop a measure that's a little more targeted to our community. And what we're able to do is look at zip codes. So we can actually go on the Department of Public Health and look up the positive cases and the total cases for a zip code. In our community, looking at our address list, 99% of our families live in these 3 zip codes: 60030 Grays Lake, 60046 Lake Villa Lindenhurst, and then 6073 is Round Lake. Unfortunately, the data isn't perfect. If you look up 60030, it's from March 13th to today. It's just the total number of cases. So what I've been doing over the last week and a half or so is just writing, just copying down those numbers, recording those numbers every day, So I can figure out what the daily increase is. So if one day there's 300 positive cases and the next day it's 310, I can do some subtraction and figure out there were 10 cases that, okay. Long story short, when we look at all the positive tests divided by all tests in those zip codes, this is what we get. The daily positive test rate yesterday was 10.06%. Today, I just updated this data. The daily positive test rate today is 8.8%. Okay, well, I just now have enough to do a 7-day rolling average to kind of even out some of this fluctuation. So the 7-day average on, as of yesterday, that was the first day, had 7 days of data, was 7.07, and the 7-day average today went up to 7.1. So again, we're well over that 5% mark, and unfortunately, our community is going toward that 8% mark. And again, that doesn't mean, you know, the health department is going to come in and do some mitigation measures, but when we're looking at our community and we're looking at the benchmarks that health professionals use, we're getting a little bit close, very close to a line we don't want to cross. I actually wanted to go a little bit further with this because our families are not distributed equally in those 3 zip codes. We actually have 50% of our families are from the Grays Lake zip code, about 31% from Round Lake, and about 18% are from the Lake Villa Lindenhurst zip code. So again, you can do the math there, that's about 99%. So for 99% of our families, these are the distributions for zip codes. What I did is weight those averages. So I can weight it, so 50% of it comes from the Grays Lake data, 31% from Round Lake, 18% from Lake Villa Lindenhurst, and this is what we came up with. I think it's a little bit more targeted, so this is the number I'm probably going to use. The daily positive test rate on the 29th was 9%, a little bit down when we target it this way. Daily positive test rate on 7/30 was up to 10.86. And I'll continue to track this and kind of see if this works. I did actually run this by Mark Pfister, and you know, he's not going to put it in a research paper or anything, but so it seemed to make sense. It seemed to make a lot of sense to weight this and, again, give a measure for our community. The 7-day average, as of yesterday, was 6.13 when we weight it this way. And the 7-day average on, as of today, again, was up 6.63, well over the 5%, and unfortunately increasing. But again, we will track this. Okay, in addition to quantitative data, what we have to consider is, can we offer an experience that we can reasonably expect is going to continue? In other words, if we open, is it reasonable to expect we can stay open? And as part of that, we have to be sure we have a solid set of recommendations from the health department, clear understanding on how those recommendations should be implemented, and a reasonable confidence that they can be implemented with fidelity. Here's where we run into some problems. So, in other words, if we start a hybrid plan and we open and students and staff are together in classes and in cafeterias and hallways and in offices, are we doing the right things? Are we looking at the right indicators? Do we have PPE in the right spots? Do we have the right PPE for our staff and our students? And what I'm looking at when I'm trying to answer that question is really, again, the guidance from the health departments. Of course, we're looking at the numbers that I just talked about. That's, again, those numbers aren't the end of the decision-making process either. So whether you think the virus is dangerous or not, whether you think students transmit the virus or not, we have to abide by the requirements and the restrictions put on us. They're in place for very good reasons, for reasons to protect our students and our staff members' health, of course, but they're restrictions nonetheless. So is it reasonable to expect who can actually do it and have an experience that's worthwhile for students? So what I want to do is take the not so simple example of the cafeteria. Right? If we bring students into our buildings for a full day of instruction, we have to provide lunch, of course, but how does that work in this environment under these restrictions? We know we're limited to 50 people in a space, but what's a space? So even with 1/3 of our students, that proposed hybrid model, we're going to have to put more than 50 in our cafeterias. So desks would replace our round tables and students will have to sit alone facing in one direction. I'm not even sure if they're allowed to talk, but so what we can do, here's one example, we can put up plastic sheeting. I'm thinking of like the cafeteria at North. We could put plastic sheeting up to divide the cafeteria into separate spaces. Okay. Question that we have is the ventilation sufficient? Some guidance we've received has stated that each space should have its own ventilation system, which is difficult to do. Other guidance has said that each space needs its own entry and exit, right? Other guidance doesn't comment on it at all. So which is correct, which is supported by science? We really don't know. We don't have the CDC or anyone coming to inspect our buildings, so again, we're on our own to figure this out. Now, is that a deal breaker by itself? No, probably not, but it's an example of lack of clarity that can impact safety. So furthermore, we've also been waiting on a decision-making flowchart from the Lake County Department of Health. We have not yet received that. For weeks, we've been waiting for a decision-making flowchart, and what I mean by a decision-making flowchart is what do we do when people test positive? Is there a difference between symptomatic and asymptomatic? Who do we notify? What do parents do? What if somebody's been in close contact with somebody who is tested positive? Do they need to be removed? What if they've traveled internationally or nationally to a region that's considered a hotspot? What are those countries and which states are on that list? Should those people get tested? Should they self-isolate? For how long? Again, does symptomatic versus asymptomatic matter? Who decides if it's a symptom or it's just allergies? How do we know the difference in schools? Right? So these are some of the questions we need clarity on and we don't have yet. We've tried to come up with our own process and our own flow chart with the guidance of our school nurses, but one would think that the chart coming from the Department of Health would incorporate the most up-to-date information. And I am not faulting the Lake County folks at all. They really want to get us this information, and they've been trying to, but there are multiple agencies that keep changing recommendations between the Illinois Department of Public Health, State Board of Education, Governor's Office, the CDC. And they're stuck. They absolutely want to give us the most accurate recommendations, but the lack of coordination between our governmental agencies is getting in the way. Ultimately, the question is if we do a 33% hybrid plan with the regulations we have to abide by, and can we keep it staffed? Can we keep students in the building? I'm going to go into that a little further. We need clear procedures and clear guidelines in order to implement a plan that we can reasonably expect to be safe and ensure is implemented with reasonable fidelity. Nothing is going to be perfect. We know that. But we need some just clear baseline information. Okay, I'm going to show you something here real quick. The flow chart I just mentioned, what I'm going to show you is not that, but it gets to some of these questions. What I'm going to show you is a draft document from, I believe it's the Illinois Department of Public Health. Don't take it as solid fact or the final version. I just happened to be in a meeting where somebody had gotten a copy of it and who was good enough to send it to me. If I wasn't there, I wouldn't have even gotten this. But I want to take a look at what we think the guidance is going to tell us. And it tracks with everything we've kind of been hearing, but again, there are a few things that give us pause. So first of all, and I apologize for this being so blurry. I got it at the last minute and did a screenshot. I'll kind of explain it. So a really normal and reasonable question in this environment is if you have a staff member or a student that you've found is tested positive and you know has been in the building and around others, what do you do? It's going to happen. We know it. One of the first questions I'm asked, and we have to have procedures absolutely solid. Let's take a look at that. So again, sorry for the blurriness. Basically what you see is the K-12 exclusion chart. Underneath that is, okay, what if a student or staff member tests positive for COVID-19? And then in the right column, 14 calendar, you have to be out for 14 calendar days minimum. And that if you still have symptoms at the end of the 14 days, you'd have to be out for a little bit longer, but like just keep that 14 days in mind, right? And I think that makes sense. If you test positive, you need to be removed for 14 days. Don't think that's, all really controversial. And again, this is a draft. Okay, so let's go a little bit further. Let's assume that an infected person has been in the building. And of course, that person needs to be removed for some period of time until we're confident that he or she is no longer infectious. Let's say it's a student, God forbid. Could be anybody, but let's say it's a student. That infected student is potentially in 7 different classes in the proximity of hundreds of people. Maybe not close proximity, but around hundreds of people indoors. Let's say that student has been in close contact with a teacher. Well, I want to define that. For COVID-19, for our purposes, a close contact is defined as somebody who's been within 6 feet of an infected person for at least 15 minutes. And well, let's just go with that. 6 feet, 15 minutes. So let's say that infected student was within 6 feet for 15 minutes, did the best we could, we were wearing masks, and just for whatever reason, we kind of forgot ourselves, and there is some close contact. That teacher, so if you see the top there, student or staff member has had close contact with somebody who tested positive, they're out for 14 calendar days. Okay, and it doesn't matter if they get our understanding at this moment is if it doesn't matter if they get a negative test, they are out for 14 days. Okay, let's say that student was in close contact with other students, even despite our best efforts. All of those people will have to be out for 14 days. So we're going to do our best, of course, to keep all of our desks 6 feet apart once we get into a hybrid model and maintain social distancing in the hallways and cafeterias, but there is absolutely no way I can guarantee that everybody's going to stay 6 feet or more away from each other. So if it's just that one teacher that's out, just one in this example, here are the questions. Can that teacher still teach remotely? Let's hope and pray that teacher is not experiencing any symptoms, but if the teacher is asymptomatic, do we continue to have that teacher teach from home and prepare e-learning materials? In a hybrid model, if the teacher is out and out for 14 days, who do we have in the classroom? Who do we have in the room for weeks while students are in attendance? So back to that hypothetical positive tested student. What if it's 2 teachers that are out? What if it's 3? Now what if it's 2 students? What if it's 3 students? This is all hypothetical, right? But hopefully we can really quickly reach hopefully you can see we will quickly reach our capacity to be able to provide a continuous learning experience in a hybrid model based on these requirements as we are trying to understand them right now. The disruption is likely going to be massive. How many teachers and staff can we withstand having out with a rolling 14-day absences? I mean, we do it every year. We replace teachers from time to time. But this situation is very different. This guidance could change in a minute, but right now, this is what's being discussed. We don't have the solid guidance. I can't open in any way unless this is clear, unless we know what the rules are. So let's keep going back to this. What if, God forbid, that teacher is not well, that she can't keep putting remote lessons together and interacting with students on Zoom? We're going to have a hard time putting just any person in that position to teach our students in a remote model or a hybrid model. You cannot put me in charge of an advanced placement U.S. history class. This is a brand new teaching style, right? Where every teacher, quite frankly, is going to feel like they're a first-year teacher. And this stuff is not taught in teaching school. Our teachers have considerable content knowledge, pedagogical knowledge, knowledge of our curriculum, knowledge of our technology and our systems, and knowledge of our students. So this is what I mean by maintaining continuity of instruction, because it's going to be highly disruptive once this starts happening. I want to give you an actual example from Lake County. In our area, we have a school who's been providing in-class summer experience for students. And by the way, it's not one of the districts that sends students to D127, by the way. It's Lake County, but not one of ours. In this in-person environment, there were about 60 students coming into the building for summer instruction. And as far as I can tell, that district was doing everything right. According to their best knowledge of social distancing and masking and cleaning and the like. And 60 students seems like a reasonable amount to be able to pilot something like this. You have plenty of space, plenty of staff. However, that superintendent told me that in the first 6 days she's had, in the first 6 days, she's had at least one student or one teacher every day that has had to be removed from that situation for the full 14 days. And it's not because they tested positive. It's because they have come into close contact with somebody who did test positive, maybe somebody even outside of school. So I look at that and I do some quick math, right? In 1 week, 10% are out. In our setting, 10% would be around 300 people. So again, don't really know if we're comparing apples to apples there, but we're trying to play this out with, again, no other real world case studies from this area to use. Okay, I'm going to keep going with this and I'll be done with this chart in a second. Some newer information here. We are also being told by this document that if any teacher or student exhibits any symptoms while in school, whether they are caused by COVID or not, they must be sent home for 14 days, unless the family brings a note from a medical professional saying the symptoms aren't related to COVID. It could be an allergy issue, like a diagnosed allergy issue, of course. But I want to look at those symptoms again. Again, any symptoms displayed: runny nose, headache, sore throat, cough, fever, shortness of breath, difficulty breathing, chills, fatigue, muscle, body aches, loss of taste or smell, congestion, nausea, vomiting, or diarrhea. This is a rhetorical question. How many people have any of those symptoms on and off repeatedly throughout the fall and winter months? How many people have those symptoms when it's not fall or winter? So again, I'm really concerned we're not going to have the capacity to maintain our teaching staff, not to mention this many students who are going to have to be out of the building. we could really run out of staff and send us back to remote only in very, very short order. And the side question here, how quickly will situations like this erode confidence that it's safe in our buildings? Hard to say. I don't think it would be good. Let me go down another road here. Again, this is logistics. Let me be clear. School professionals or school personnel, we're not contact tracers. I don't want to give that impression. That responsibility would be taken by the Lake County Department of Health. And as a side note, they're definitely building their capacity to do contact tracing, which is a great thing. So they're going to be doing the contact tracing, and they're going to be making phone calls to try to gather information and determine, and back to the situation of the infected student, not the symptomatic, but the infected student. They're going to be making phone calls to try to gather information to determine where that infection came from and who else might be infected. But we do have a role in that. We have to determine who an infected person has been in close contact with, and we have to provide the health department with that information. So we've got to retrace that student's schedule or that staff member's schedule if they're infected, probably over a couple of days, and gather information of who they might have been in close contact with and give that to the health department. And then we have to shuffle multiple rooms and clean and all of those details. But they would start making the calls and contact tracing, but for our purposes, we have to track who's out, why they're out, whether they need to demonstrate a negative test or not, or if we have to wait the full 14 days. And remember, we don't have those procedures from the health department yet. This is going to be an ongoing issue with dozens of people or more who go out on different days for different periods of time under different conditions, and tracking that is probably going to be somebody's full-time job. Can it be done? Of course. But I hope you can see how quickly we might reach our capacity to operate safely. In something like this, which is new, which is highly complex, my very serious concern is that something is going to get missed, and that puts our students and our staff in jeopardy. And without a more robust testing program, which is a whole other issue, we won't know if we have an outbreak in the school. We'll be flying blind. Again, the guidance, the message we've gotten, schools, if you got people wearing masks and you're doing social distancing and you're cleaning better, go for it. Again, the message is you're on your own, figure it out. And I appreciate the focus on local control, but we need more. It shouldn't be up to our school district. We're not public health professionals. We're not epidemiologists. We don't have unlimited resources or unlimited staff. Okay, we're going to, again, rely on the guidance from our health departments. And I'm not trying to denigrate them. They are under the gun as well. They are working under unprecedented conditions. They're being asked to coordinate in a manner that they haven't been asked to before, right? And all this is still moving fast. So I want to give those folks a little bit of grace too. And they have been great to us. But that being said, it doesn't make it any easier to try to plan for a school situation that's never been done before in the middle of a global, once-in-a-century pandemic. So in order to provide an experience that we're confident is reasonably safe, it never will be 100% safe. But I have to provide the assurance to the community and my staff that we are confident that we can provide a safe environment and it's sustainable. So in this environment right now, it's nearly impossible to have a fundamental understanding on what it is that makes schools stay safe, specifically schools, because there's a level of complexity in schools that is different than other situations. Without that guidance, without that understanding, we can't set up the systems and procedures that are needed, the systems that haven't existed before. We can't set up the systems, and that's even before we talk about training staff and setting up ways to teach students what they're supposed to do. And school starts in less than a month. So again, going through all of this and more, but I'm just giving you some highlights. This is what led us to the decision to start remotely. Okay, we've got to decide what to do. We've got to give teachers enough time to plan. We've got to give our maintenance staff enough time to know what to plan for. We've got to give parents enough time to plan. We can't wait till August 16th, hoping that all this info is going to be decided and set to announce a plan to be put in on August 17th, right? We got to make a call, and that's what we're going to do. But that is our recommendation, to start remotely. And that's a draft. So, metrics, kind of back to that question. What are we going to use when we decide if we're ready? Okay, first of all, when the targets stop moving. What I mean by that, coordination among our health departments and the State Board of Education, consistent use of data and consensus on the quantitative indicators. We're starting to get to that, but the interpretation is something we're working on. What does it all mean? We need some consensus on definitions and procedures, like close contact. That was up in the air for a while. We think we know what that means. I need a solid definition. What do we do with symptoms, symptomatic cases, and 14-day isolation, for example? The data we're going to use, the two numbers I have mentioned, the new cases per 100,000 residents, the percent positive cases. I'm going to really target that zip code, the weighted zip code. We also need to see what states are on the travel ban and what that means, and specifically Wisconsin. If Wisconsin gets put on that travel ban, what happens? Not sure. Staff capacity, again, including substitute teacher availability. I don't know yet if we have enough staff to staff a hybrid plan. And that goes to the logistical capacity as well. All this tracking, all this cleaning, moving rooms, switching rooms around. We need a little time to study that to see if we have the capacity for it. Appropriate PPE for schools. I didn't really talk about this. We're doing the best we can. Again, not a whole. We need to constantly monitor that and see if we have missed anything. If we need additional plexiglass or additional, protective measures for our staff and students. And again, testing capacity in the region, not something that I can change, but we absolutely need a better testing program. When these tests come back and it's taken 7 to 14 days, again, we're flying blind. We don't know if there's an outbreak in the schools. So these are some of the things we're going to be using. So let's talk about going from remote to in-person. So I'll just start here. Because we need a plan with more phases, right now what we're proposing is phase 1, starting right now, is starting with remote learning. I'm going to talk more about, again, what that is in a second. We'd like to continue with our extracurriculars and sports. It's a different thing to have students after school, again, when the buildings are free, the buildings are empty, there's more space. We would like to try to work on a way to continue our sports. We've just gotten some guidance from the state on the status of sports, which we're still going through. But we think we would like to start possibly bringing back, extracurriculars after school. And that would be August 20th through Labor Day. That's about 2 weeks and 2 days. Okay. The next phase would be, again, remote learning. We'd like to continue with our extracurriculars and sports, but we really want to look at bringing select groups, some of our needier students who really need supports in person, back during the day. Potentially, some of our CTE students, if we can figure a way to get them back in the buildings to do some of those hands-on things and labs and equipment, we're working on that. That's not definite, any of this, but this is what we're working on right now. This phase would be, that's right after Labor Day, September 8th, I think that's a Tuesday, through Q1. But we would evaluate, actually throughout this process, but definitely at 6 weeks, which is about October 1st. Q1 ends, I want to say mid-October, October 17th, I think. So phase 3, in an ideal situation, if everything works smoothly and we're feeling confident about this, remote learning 2.0, again, as I mentioned at the last board meeting, the remote learning is still going to be the backbone of everything we do. So parents and students would have a choice if they want to come in or not. So remote learning, the extracurriculars and sports, and then potentially the hybrid in-person model that I ran through a little bit at the last board meeting. Q2 through the end of the semester, and that's kind of as far as we've gotten. Right now we're making a lot, well, we're not able to make very many predictions because things are happening so fast. So, I did want to run through some different schools' remote models, and this may have changed. I've tried to just check through websites and make contact with some of the folks that I know from these districts. So Stevenson is remote, full remote, the entire first semester. Niles is very similar to us, starting remote, bringing groups back to buildings early September. Glenbrook, the most I could find, and this may have changed, again, starting remote with a gradual return to the classroom. Evanston, begin remote learning August 17th. U46 in Elgin, the second largest district in the state, distance learning through at least October 9th. Oak Park River Forest, full remote. And then from some schools in our areas, Warren, full remote through October 2nd. Libertyville, Vernon Hills, remote. Round Lake, remote through October 1st. And again, there are more, and these may have changed, so I apologize if it's not up to date. This is moving real fast. But our model is very similar to a number of other schools. We're all kind of thinking the same thing. All right, let me go through the timeline real quick. There's a couple of little changes, hopefully nothing too drastic. August 13th and 14th would be our Teacher Institute days, and that's not a change from the original calendar. August 17th, freshman activities, I think class supply pickup. Again, our buildings will be sending out information about that. Here's where there's a little bit of a change. Under the current legislation for the remote learning education, school districts have 5 remote planning days that they can use, again, kind of like an institute day, but specifically designed to get teachers up to speed with remote planning. Our teachers have been working on this since March, for sure. And we've been sending the messages that remote learning is going to be part of our lives in one way or another. So we need to make sure we're working on that over the summer. But these 2 days, we want to make sure we've got full days. We've got some activities planned. We're making sure we're communicating that everybody's on the same sheet of music, what the expectations are, and we are ready to roll on August 20th, which would be the first day of student attendance electronically with Remote Learning 2.0. September 8th, we would think about bringing groups of students back into the buildings, start that process. October 1st, as I mentioned, that's by that date we would reevaluate our hybrid model, whether or not we're ready to go with that, and then October 18th would be the start of quarter 2. All right, I've spent a lot of time talking about our decision-making process, and I think that was necessary. I think people need to really know what our thought process is to some degree. But I would really like to talk about what remote learning is going to be and some of the changes that we're going to make. So you saw in the student comments, they really like the bell schedule. I think the parents like the bell schedule as well, so here's the bell schedule. Monday would be more of a traditional 8-period day. The periods are slightly shorter, but it's a late start, so that gives our buildings time to do staff meetings or departments time to do department meetings, professional development. But the day would start period 1 through period 8, starting at 9:30 for period 1 and then ending at 3:15. Tuesday, Wednesday, Thursday is the block schedule, and it kind of alternates. Each period is an hour 15 minutes long, so longer than a traditional period, but it's every other day. So period 1, 2, then there's a break, then period 3 and 4, there's a break, and then there's time an hour there for independent student-teacher meetings that can be set up, and then 3:30 is when the optional clubs and activities might happen. And again, we're looking at transportation and providing transportation to make sure all kids have equal access to participate in those activities if they choose to. So Tuesday, Thursday would be periods 1, 2, 3, 4. Wednesday, Friday would be 5, 6, 7, 8. And then Monday again is full schedule. And again, any of my staff that's on, if you want to jump in, if I've missed something, please feel free. So again, this is not e-learning from the spring. So what we want to see is more engagement between students and staff. And staff will have Zoom sessions every class period. Again, these might not be the full period. They might just be check-ins. But we want to make sure we're providing a structure and we're providing that synchronous learning, that in real-time learning and making connections. Students making connections with teachers and with their classmates. There will be ongoing instruction at that time. There will be grading of new content and feedback. Teachers are engaging in lesson development and professional development and have been over the summer. As I mentioned, they'll continue to do that. It'll be an ongoing process this entire year, regardless. We're looking for consistency across teaching teams and grading and assessment, which is what we would expect in a normal school year anyway. Weekly work posted in Schoology on the first day of the week, including links for Zoom meetings, homework assignments, due dates, etc. I think I spent a little bit of time talking about that. Again, I think the students found that to be very, very valuable and helpful in organizing their teacher availability. Emails, phone calls, Zoom meetings, discussion boards during the workday, of course. There's time for individual appointments during common off hours. And there's that 1 hour of time dedicated to student supports at the end of each school day. Student expectations. We expect that students are going to check in for attendance each day. They're going to complete and submit all assigned work, attend all scheduled Zoom meetings and other scheduled online engagements. We realize that home situations are different. There has to be some flexibility there, but the general expectation is that students would attend all those Zoom meetings. And if they're unable to attend, we ask that students notify their teachers in advance and review any recordings of meetings posted by the teacher or any supplemental materials, so that those materials should be available to students. We expect that students practice self-advocacy and requesting assistance when needed. Now, that does not mean our teachers are not going to be reaching out. You know, if they see a student struggling, or just reaching out just to, you know, say hello and see how a kid is doing. But students are in a remote environment. Self-advocacy is a big skill, so we're going to be stressing that. We expect that students take advantage of the online academic and social emotional supports that are going to be available throughout the day. Excuse me. So, again, hopefully, if you're concerned about remote learning, was it going to look like the spring? It is not going to look like the spring. Talk about grading and assessment. Once again, grades count. Teachers will be grading and assessing work in PowerSchool. Parents can check a student's academic progress in PowerSchool, again, like a normal, typical school year. We're going to be removing the traditional final exam schedule. In a remote environment, assessment has got to look different, right? The final assessment's not going to count for 20% of a student's grade. We're encouraging the use of more project-based assessments that are really better suited to an online delivery. Oops. Flip by that a little quicker than I wanted. Grading is going to look a little bit different. Assessment's going to look a little bit different. It has to in a remote environment. Okay, the SAT last year was canceled in April, as I'm sure many of you know. But the College Board currently has stated they will offer an SAT with essay for our current seniors who missed their SAT in April. But that'll be offered, we believe, in October, and we're awaiting additional details for planning and ordering purposes. Given our current information, we intend to offer a virtual SAT prep course early in the school year. AP teachers are going to engage students with assessments that mirror what their respective AP exams will look like. I don't think we have word yet on exactly what AP is going to look like. They did a very modified version last year, but we assume there are going to be AP assessments, and our teachers are going to assume they're preparing students for the regular full AP test. And we're going to continue to share updates as the College Board. And again, the College Board is the organization that does the SAT and the AP. But as the College Board releases information about the fall and spring assessments, we will make sure everybody is clear on what's going on. We will have virtual evening college and FAFSA nights. And FAFSA, again, is the financial aid form that parents fill out. That usually is once you're getting closer to thinking about applying for colleges. Virtual college rep visits and virtual counselor meetings during intervention hour or lunch or study hall. Okay, so our counselors are going to be reaching out as well. And our student support teams are going to be reaching out to our students as well. Tracy, is there anything that I've missed in all of this or anything you want to highlight?
No, I think you covered it, but just that we are very aware that we need to be supporting our juniors in particular as they're and seniors as they're preparing for their college years and their college search, and that we are planning things to make that a priority.
Okay. Great, thank you. Okay, well, let's talk about hands-on classes a little bit. Students will continue to interact with our art, music, career technology education classes, and life fitness teachers remotely. Students in those hands-on CT and art classes may, and we got to work this out, may be among those students we bring into school in small groups to access equipment after Labor Day, or studios, or things like that. Our CTE classes are looking into online certifications that students can earn virtually as well as other robust online curricula. Oops. Sorry, keep slipping by these slides a little bit too quickly. So this is something we're working on. It is, something that is trickier in a remote environment for sure, but we want to make sure those students are supported, and it's a worthwhile experience for them. Now, the tech campus, kind of going along this, the tech campus will be, we just learned that they are going to be remote as well. They're going to expect a daily check-in and attendance. There will be synchronous learning or real-time learning and asynchronous learning that you can do on your own time. Our liaisons in D127 are going to be working with our students and their families around scheduling. Again, the block schedule is a little new and different. So we want to make sure that whatever periods a student is scheduled for the tech campus, that we're able to fit that and kind of work that in with our block schedules we're working on. Okay, academic interventions and supports are a big part of what we do here. Helping students who are struggling, who need help. You know, we are right now, both buildings are developing plans to offer these interventions, to offer them remotely, and students are going to have access to virtual online support throughout the school day. So again, something that's very important to us, we are working on. Let's talk about special education. So most students with IEPs will access their education as outlined in student expectations and be provided support as designated in the IEP. There may be adjustments that need to be made based on a mutual agreement between the school and parents or guardian. Again, operating remotely is a little bit different, and most likely when they were preparing a student's IEP, weren't thinking about how this operates in a remote environment. So we will be working with parents on that. Again, two-way communication ensures services and supports are flexible and adaptable to this changing environment. Teachers in our co-taught classes will be available via Zoom to provide services during scheduled classes. And our related services like speech, social work, occupational therapy, physical therapy will be provided via Zoom. Students in outside placements. Right now, our plan is to have them follow the learning plan as outlined by each individual school. Transportation would be provided as documented in the IEP, but we're monitoring those schools and what their plans are, and they're not all available right now anyway. IEP meetings will continue to be held remotely. Our school psychologists will continue to conduct individual student evaluations on campus following safety protocols that will be put in place. And again, staff will work with students and parents and guardians to monitor the effectiveness of these supports and, explore other options as needs arise, as we expected. Okay. Talk a little about social emotional learning supports. All students will have access to their school counselor, their deans, their social workers via Zoom, via Google Hangout or Google Voice, Gmail, Remind, or Twitter. And again, staff will be reaching out to students. This is not something where our student support teams are just kind of waiting for kids to call them if they're having an issue, which they're more than welcome to do. But our staff is going to be out talking to kids, working with kids, and trying to make contacts on our end to our students. We're working on that right now. There are a number of different resources that are being developed as we speak. For example, weekly short videos for students that offers social emotional learning supports like learning to breathe and SEL pillars. And there's actually a link once the presentation is out to one-stop shop resources as an example of some of the resources that are going to be available to students. Well, talking about operations, our operations folks, when we return, we will be ready. Schools, again, will be cleaned and sanitized every day, and this is remote or hybrid regardless. They'll be cleaned and sanitized every day, including the use of our electrostatic sprayer in learning spaces. Frequently touched surfaces like door handles, bathroom doors, etc. will be cleaned throughout the day. Hand sanitizers available for staff and student use. Buses will be wiped down between every bus run. And we do have temperature screening at every entrance. We're going to continue with our food distribution program, and we've been running that since March throughout the summer. It has worked well to operate out of the Grays Lake North cafeteria. Now it's available to anybody in our community, regardless of campus, but anybody in our community. There are no questions asked. We'll distribute the food Tuesdays and Thursdays from 9 to 11. So, and more information will be coming on that. Okay, technology. Again, you don't have to write all this down. This will be coming out, but just want to let people know there are help desk tickets. So if there's any kind of tech issue, students can fill out a ticket, and our tech staff will respond and try to help with that. It's a new format that staff, students, and parents can access. And again, once you have access to that link, you can click on the portal, or there's an email there for help desk as well. Again, a lot of tools, a lot of training resources are going to be available, all about the District 127 Chromebooks, the Zoom room, schoolroom. Our instructional coaches have a whole bunch of resources which are really wonderful. And equity is a big piece of this too, technological equity. We have numerous hotspots from T-Mobile, and some are already in the hands of our incoming sophomores, juniors, and seniors. In the case that a family does not have consistent, reliable Wi-Fi access, that is absolutely essential to this model. Okay. We have a number left for any incoming freshmen that may have issues with access, and we'll be communicating, with our families about this. Okay, athletics, as I kind of mentioned, a whole bunch of guidance just came out. You may have seen Governor Pritzker's press conference on that. We are just going through it right now, so I don't want to speak too much. I literally copied and pasted this from a guidance document that I got. But certain fall sports are not going to be allowed to happen in the fall, some of those high contact sports. As a result, the IHSA calendar is going to be adjusted with some tentative timeline. I'm not going to go through all these bullet points. And again, as I say, we're still going through this. But different sports are going to be allowed to continue. Other sports on a very limited basis, and certain sports are either not going to be allowed to be played yet, or potentially put off till later. So again, much more is coming out with that. We know how important sports and extracurriculars, but in this context, sports, we know how important that is. And we want to try as much as possible while we're trying to figure out how to get classes going on. And all of that complexity, we've had some good success over the summer with bringing students and coaches together. And they've been able to do it, I think, in a reasonably safe way, So knock on wood, things are going that way. That we have had some issues we've had to track down, but they've, by and large, done a really fantastic job with our students. Freshman orientation has begun. We had freshmen in our buildings. I was here at Grays Lake Central looking at some students picking up their Chromebooks, so that was a lot of fun. There are many activities. There are communications coming from our building about, again, freshman orientation and equipment pickup and the like. So again, much more is coming. Okay, we're at the end of our presentation. So some resources. A lot of resources are going to be coming out. Many are being worked on right now. What I want to share right now is pretty simple. I'm going to send out this presentation tomorrow to the community. And I'm going to send it from like a do not reply access. Not that I mind getting emails. My email is still available. But what we want to do is really send to people if you have a question or a comment, because we know there are going to be tons of questions. We want to send people to this form. Let's see if I can get it to pop open. Pretty simple. If you have a question, your name of your kids, child or children, your telephone number, email address so we can get back to you, what's your campus, what year, and we tried to categorize the types of questions, right? So my staff is going to have access to this form. So we know if it's an athletics question, they're going to be able to sort and go, oh, our athletic directors are going to try to answer those or be able to answer those questions. If it's a schedule question, we know our associate principals for curriculum and instruction, that's probably going to be them. So we're going to be able to target really quickly who is answering which questions. If I get a flood of emails, that's fine. I don't mind, sending emails to the right person. I'm just worried things are going to get lost, and hopefully this will be much more efficient. We do still have our COVID-19 reopening site. So again, any information will be here. This presentation will be posted here. The recording of the presentation and the slides themselves, and our return to learn document, which is also here. So everything that I was talking about with remote learning are provided in much greater detail here. There we go. A little time loading up. So again, this document has much more information. And I said, as we were going through this presentation, you don't have to write all these things down. You don't have to write the website down. It's all going to be provided to families. And that, my friends, is the end of my presentation. So, sorry, that was a lot. I appreciate everybody's attention to that. But again, there were a lot of things we really need to get into some detail, some depth. So please, anybody have any questions?
Board members, do you have any? I know that's a lot, and I know that the board members have already reviewed the presentation beforehand, and I know there was a lot of questions beforehand from board members. If you have additional questions, if you would like to unmute, and you can have the floor.
I think I do, Kathleen.
Okay.
My question would be, I know this has been brought up to me by teachers during the past couple of months. Their supplies and some of the resources that they need out of their classrooms, and I know I talked to Tracy and Mikkel about this, they seem to want to have to bring a lot of that stuff in or out of their classroom into where they're remote learning from, whether it's their house or not. I guess the question is there any, for some of those classes, was anything thought about those teachers that needed that resources, either number one, getting them, or number two, can they teach from their classroom? That's my question.
Yeah, I mean, right now, before the school year starts, obviously people are wanting to get into classrooms. We do have a sign-in sheet because anybody in the buildings, we want to know where they are so we can clean and sanitize when they're gone. Central's a little bit tricky right now because there's a lot of construction going on. So some rooms are limited for that, but once remote learning starts, our intention with staff would be able to come into their classrooms, because sometimes it's easier. If they want to do a recording, they've got equipment there. It's a lot easier to do it in the room. So we're going to allow that. I don't know, Dan, Jim, Landry, Gonzalez, Jim Roscoe, anybody want to kind of chime in on that?
Yeah, Russ, there's going to be a more fluid approach to teachers that want to come in the building, gather resources. And as Mikkel already said, if they feel it might be more beneficial to come and do a demonstration in their classroom, they'll be able to do that. So they'll have all those opportunities throughout the semester.
Dan? Actually, I have questions from both schools from different teachers. So I know there's from North and there was from Central. And they're just knowing that the accountability and the grading, that they need some of those resources, and they want to make sure that they somehow get communicated how they can do that.
Yeah, all that communication will be going out, Russ. We are in weekly meetings with our building leadership as well as our staff. So that will all be accommodated for staff that either want to come in or staff that need to retrieve materials. But all of that will be accounted for.
Dan, is that equal to Grays Lake Central as Grays Lake North?
Yes.
Okay. Thank you.
Okay, thank you, Russ. Are there any other board members that have questions at this time? Well, that's unusual, but I know you've been keeping up on this. Mikkel has been answering your questions, I know, on a daily basis, so thank you. Okay, Mikkel, on behalf of the board, I want to thank you for the tremendous work that you've done, and also your administration. This is absolutely outstanding, and we appreciate how quickly you turned this around. We were all headed into a hybrid model, and this was a pivot, but you guys have been amazing, and it's been a lot. On behalf of the board, thank you.